name is Rachel. I'm going to be your nurse today. Can I get your name and date of birth?
Joanna Baumgartner, 2/21/72.
Alright, let me check your armband. Alright, that's what I have as well. I'm going to go ahead and foam in, put my gloves on. The information you shared to me in this head-to-toe assessment will only be given to your doctor and Mercer University. Do you consent to be in this video?
Yes.
And is English your primary language?
Yes.
Okay. You seem to be speaking and hearing clearly, so I don't have any concerns there. Your age looks about what your developmental status is. Your height, weight, and posture look good. You look to be in good health. Are you in any pain today?
Yes.
Alright, and on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever felt in your life, what would you rate the pain as?
A 4.
Okay. And where's this pain located at?
In my elbow.
Okay, when did it begin?
3 days ago.
Alright, and what are the characteristics? Is it a sharp stabbing pain, a dull, achy pain?
Dull, achy.
Is there anything that alleviates the pain?
Advil.
And what aggravates the pain?
Constant movement.
Alright, what is there a time of day that it's worse at? Morning, nighttime, or
Nighttime.
okay. Alright, so I will let your doctor know about that. I'm gonna start your head, eyes, ears, nose, and throat now. So your sclera looks healthy. Assessing your cranial nerves 3, 4, and 6. There's no swelling or ptosis of the eyelids. I will now assess your fields of gaze if you will follow my pen light. And convergence. So that's cranial nerves 3, 4, and 6. Next, I'm going to go ahead and dilate your pupils. So just look straight ahead for me. Alright, so your pupils went from about 5 millimeters down to 3 millimeters, and they are equal, round, and reactive to light and accommodation. So your nasal mucosa looks good, and your oral mucosa looks good. It looks pink and moist and is free of lesions or sores. Can you open your mouth and say ah? Ah. Alright, your uvula rises equal bilaterally. I'm going to go ahead and assess your swallowing. Alright, and those both assess cranial nerves 9 and 10. Can you say light, bright, dynamite?
Light, bright, dynamite.
Alright, and that assesses cranial nerves 12. So next I'm going to go ahead and assess your integumentary system. So your skin integrity looks good. You don't seem to be having any pressure ulcers or sores or eczema or anything. I'm going to go ahead and palpate the temperature of your arms and assess your skin turgor. Alright, you seem to be hydrated. Can I assess your radial pulses? Alright, they are equal bilaterally. I'm going to go ahead and assess your temperature of your legs. That looks good. I'm going to take your shoes off, okay?
Okay.
And your socks. Your dorsalis pedis pulses equal bilaterally, and your posterior tibial pulse is also equal bilaterally. I don't see any edema or swelling of your arms or legs, which is also good. Can you stick your fingers out for me and let me assess your capillary refill? Alright, your capillary refill, your fingers was all less than 3 seconds. I'm going to do the same with your toes. Alright, your toes were also all less than 3 seconds. So your skin color also looks good according to your ethnicity, so I think your integumentary and peripheral vascular systems are both intact. So next I'm going to do your mental neuro status. Do you know where you're at today?
Yes.
Where are you at?
Disney World.
Awesome. Do you know what you had for breakfast this morning?
Yes.
What did you have for breakfast this morning?
Toast.
Sounds good. And do you know who the President of the United States is?
Yes. Donald Trump.
Awesome. So you are oriented to person, place, and time, and do you know what day of the week it is?
It is Wednesday.
Awesome. And your immediate, recent, and remote history is all intact as well, which is good. So will you go ahead and stand up for me?
Yes.
Put your arms out and close your eyes.
All the way out?
Yep, all the way out. And close your eyes. Alright, you can open them again. So that assesses your balance and coordination. You can put your arms down, and that's the Romberg test. All right, will you just walk to that wall and back for me? All right, your gait looks good. And while you're standing up, will you go ahead and rotate your hips out for me? Awesome. You can go ahead and sit down now. So your range of motion looks good in your hips. You look good. Your reflexes are intact and everything. Will you move your shoulders like this for me? And your elbows. And your wrists. And just move your fingers like this. Will you touch each finger to your thumb? And squeeze my fingers. All right, that assesses cranial nerve 11. Will you bend your knees for me out? All right, good. You can put them back down and rotate your ankles and wiggle your toes. All right, those are also good. So your range of motion is really good as well. Next, I'm going to assess your strength. So don't let me push down. Awesome, that's cranial nerve 11. Will you put your arms out like this? All right, don't let me push in. Don't let me push out. Will you rotate your hands like this for me? Don't let me push towards you. Don't let me pull. All right, next I'm going to do your legs. So will you pull them apart just a little bit? Thank you. Don't let me push in. Don't let me push out. Don't let me pull. Don't let me push. And don't let me pull up on your feet or down. Awesome. So your strength is also very good. All right, so I'm going to go ahead and assess your respiratory system. Next, you can just sit like you are. Are you having any difficulty breathing or chest tightness?
No.
Okay, you can breathe normally. I'm going to assess your respiratory rate. So your respiratory rate is about 20 breaths per minute. I assessed for 30 seconds and multiplied by 2. In a normal health exam, I would assess for a full minute. So next I'm going to go ahead and auscultate your breath sounds with my diaphragm. You take a deep breath in and out. Alright, awesome. Will you face this way for me just a little bit? I'm going to go ahead and also take your breath sounds posteriorly as well. And breathe in and out for me again. Alright, you can sit back straight for me. So you don't seem to be having any diminished breath sounds. Your breaths all sound really good. And you don't seem to be using any accessory muscles or be having any difficulty, which is also good. So next I'm going to go ahead and assess your cardiac system. So will you look that way for me? And look back towards me. Right, you don't seem to be having any jugular vein distension. I'm going to go ahead and auscultate or palpate your carotid arteries individually. Awesome. Now I'm going to auscultate them with the bell. Alright, I don't seem to be hearing any bruise, which is good, so your carotids are intact. Next, I'm going to go ahead and auscultate your heart sounds. So will you face this way just a little bit for me? Thank you. First, I'm going to use my diaphragm. So your aortic is on your right sternal border, second intercostal space. Your pulmonic is on your left sternal border, second intercostal space. Your tricuspid is the fourth intercostal space, left sternal border. And your apical is the midclavicular line, about fifth intercostal space. Will you lay down for the apical for me? I'll have to move your breast out of the way a little bit. Alright, so I listed your apical pulse for 30 seconds and multiplied 2 to get 60 beats per minute. Next, I'm going to go ahead and do it with the bell as well. So your right sternal border, second intercostal space is your aortic, pulmonic, tricuspid, and mitral or apical. Alright, they all sound good. You can sit back up for me. So your heart sounds good. You don't seem to be having any murmurs or anything, which is also good. For the purpose of this video, I only assessed the apical for 30 seconds, but I would have done it for a full minute in a normal health assessment exam. So if you'll lay down for me one more time and assess your gastrointestinal system. Have you been having any pain in your abdomen?
No,
When was the last time you had a bowel movement?
12 hours ago.
And was it a weird poop or was it a normal formed stool in normal
Normal.
color? Was there a different odor to it or anything?
No,
Okay, and when was the last time you voided?
about an hour ago.
Okay, was there any sediment, pus, or blood in it?
No,
What color was it?
light yellow.
Awesome. So I'm gonna go ahead and listen to your bowel sounds. I'm going to start in your right lower quadrant. In the right upper quadrant. Left upper quadrant. And left lower quadrant. Great. You have normal active bowel sounds, which is good. For the purpose of this exam, I did not listen for a full 5 minutes, but normally I would have listened for a full 5 minutes. So next I'm going to palpate your abdomen for tenderness in the same order. If you have any discomfort, please let me know. So right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. All right, you can sit back up for me. So that concludes our health assessment exam today. The doctor will be in to talk with you shortly. I'll take my gloves off and foam out.